So the bacteria that causes glanders is Burkholderia mali. It occurs in Asia, Africa, and South America. It has been eradicated in Hungary in 1956. Burkholderia mali is an obligate pathogen, and infected animals are the source of the infection. It has a low resistance in the environment, however it can survive in water. And the hosts are, in order of most susceptible, are donkeys, horses, carnivores, camels, and humans. It's also zoonotic. Since it's an obligate pathogen, carriers introduce the bacteria to other animals, and then these animals remain carriers. The bacteria enters the body through the oral nasal route, and then it goes to the lymph node. And from the lymph node, it'll get into the blood, and then it spreads to the nose, the lungs, and the skin. And from here, the bacteria will cause granuloma formation, and necrosis and exudation. There will also be cicatrix, which are star-shaped lesions in the nasal cavity. In horses, it's a chronic infection. They can get anorexia, purulent conjunctivitis, nasal discharge, it can be mucopurulent or bloody, as well as the star-shaped cicatrix lesions in the nose. You'll also get enlarged lymph nodes. They are not movable. This is different to strangles, where the lymph nodes are movable. In the pathology, we can see pneumonia, with pyogranulomas on the lungs, as well as purulent granulomas in the liver, lung, and spleen. In donkeys, they are very susceptible. They get acute septicemia, pneumonia, and they die. In the less susceptible animals, such as carnivores and camels, they don't really get clinical signs, sometimes in the navel cavity. For the diagnosis, we can use PCR, IF, and immunohistochemistry. But when diagnosing on a herd level, we use the Malian test. The Malian test is a drop test. You drop fluid in the eye, and after 36 hours in total, there will be purulent conjunctivitis if it's positive. There will also be edema and swelling. And by the measurements, we check that it has increased by 5 millimeters. This means it's positive. And antibiotic treatments are not successful. They remain carriers. And there is no vaccination. For meloidosis, it occurs in tropical regions, such as North Australia and Southeast Asia. Unlike glanders, it is a facultative pathogen. It is found in the soil and water, and the host range is swine, cattle, horses, sheep, goats, and humans. Just like glanders, it is zoonotic. The predisposing factors are warm, rainy weather. The bacteria will enter through the oral nasal route, and then it'll go to the throat, and from there it'll go to the lymph nodes and then the blood. When septicemia occurs, it'll cause abscesses in the parenchymal organs. So in acute cases, it'll go to the lungs, and in chronic cases, it can go to the brain, as well as causing diarrhea. In the acute clinical signs, they can vary. However, we will get purulent nasal discharge, fever, anorexia, and dyspnea. And in chronic cases, we will also get purulent nasal discharge and dyspnea, as well as CNS signs and diarrhea. One of these CNS signs includes circling, so the horse will walk in circles for ages. And in the pathology, we will see abscesses. For the diagnosis, we can use PCR and ELISA. And unlike glanders, it can be treated by antibiotics. In the case of meloidosis, antibiotics will cause the bacteria to be fully eliminated from the body. I made a mistake at the start of the video where I said glanders can be treated by antibiotics. Glanders cannot be treated by antibiotics, only meloidosis. And for prevention, since the bacteria is in the soil, we can just change the pasture.